In talking to Dr Stefan now, we were going to chat about the men, because I know we often forget to talk about them because a lot of women get a lot of cosmetic work done, but the men can do it too. So what kind of treatments are they coming to see you for?
Absolutely, Roslyn. That's a really good question, because even though 95% of our patients would be female, there is still a significant 5% of men. And I think over time, in the 13 years or so that I've been practicing cosmetic medicine, I am seeing more and more males come in for treatment. Because men do deserve to look after themselves. And I guess the main thing with men is that, if for my philosophy and for a lot of men, is that they don't want to wish to look done. They certainly don't want to be going out most of the time and parading that in front of their mates at the pub. So it's about trying to keep it really subtle, trying to make sure that at the end of the day they're still looking very masculine, but they're just looking a bit fresher, so that even though they may feel tired because they've got 3 kids running around at home and 5 boards to attend to, they don't look it, and they've still got plenty of vigour to keep up with the younger ones that are nipping away at the heels.
So what kind of treatments would you suggest men could maybe come and have a look to chat to you about?
Yeah, so that starts from the most basic things like anti-wrinkle injections, for example, because for men, it's okay to have a few lines, but what you may not want to do is have the full forehead of the Gordon Ramsay. So it's about softening that up and making that, still having the character, but just a little bit softer. So we can start with that. Other popular treatments that men get would include dermal fillers, because for men, as opposed to women, a male looks more attractive, and studies have shown this, if they have a bit more angles. And over time, we do get a bit softer, unfortunately, in our angles. So it may be, for example, to enhance the malar prominences, to enhance the jawline, to give a bit of a stronger jaw, a bit of a stronger chin, for example. Those things we can easily do, and they would give you a more youthful look without necessarily looking done.
What about something like the tone and texture of the skin as well? Because men obviously age the same as women, and sunspots and treatments are obviously something they might want to focus on. Is that something else?
Yeah, absolutely. Because unfortunately, whilst women tend to look after their face and their skin from a young age, men don't really tend to do that. Whereas I find that females tend to don't mind coming on a regular basis for our maintenance treatments, such as our laser facials. The men would prefer to come in to get things done and forget about it, set and forget. And that's where something like the Fraxel might be useful, because it's a one-off treatment. You get it done, you forget about it for a year, then you come back the next year for me to give it a bit of a tune-up, almost like an annual service for your car.
Yeah, terrific. Well, if the men out there would like to have an appointment with Dr Stefan, they can do that at Concept Cosmetic Medicine.
Thanks, Roz.